Dear committee, dear audience, let me present my PhD work. I'm Tímea Lőrincz-Molnár, a pediatrician resident doctor interested in pediatric neurology. Our aim is to help children and their families dealing with neurological conditions while improving the diagnosis of paroxysmal events in childhood. Therefore, we are investigating the differences and characteristics of epileptic seizures and paroxysmal non-epileptic events in childhood based on patient data and Video-EEG monitoring data. Throughout our project, we are performing two distinct scientific methodologies. First, a systematic review and a meta-analysis, then a registry analysis, while we are wanting to answer the same clinical question, and we are using the same PECO question framework. And let's move on to the first project, which can offer a new perspective to pediatric neurology. So the most common neurological condition in childhood is epilepsy, affecting approximately 1% of the pediatric population. And sadly, nearly half of children with paroxysmal non-epileptic events are misdiagnosed. These are events that resemble epileptic seizures, but do not involve abnormal electrical activity in the brain. And sadly, the misdiagnosis is crucial. First, in case of overdiagnosis, children and families will face a social stigma, and children can have lowered educational expectations. Contrary, in case of underdiagnosis, there is a still undertreated underlying condition in case of the patients. And sadly, the diagnostic delay can exceed even beyond 20 years with potential harmful events on patient's life. But how can we diagnose these entities? Our current routine diagnostic method consists of patient history taking, neurological examination, and review of the home videos where parents capture the suspected events, and the EEG. But due to the lack of differential diagnosis protocols, the misdiagnosis is common. And the gold standard is the long-term continuous Video-EEG monitoring, but as it requires special expertise and equipment, it's only in limited availability, only in epilepsy centers. Therefore, our aim is to characterize the main differences of PNA in childhood based on Video-EEG monitoring in order to get help which can be used during the routine diagnostic method. Therefore, we have to answer the next following question: what are the Video-EEG and patient history data differences between epileptic seizures and PNA in children? We are investigating children in paroxysmal events. The exposure is epilepsy, the comparator is PNA, and we are dealing with patient data and Video-EEG characteristics. And we propose that there are notable semiological differences between the two entities. We conducted a systematic search. Here you can see our search key, and at the end we ended up with 39 eligible articles for further analysis. These articles contain data about patients aged between 1 month and 21 years of age, and we could do further age-dependent sub-analysis. We have an infant and toddler subgroup consisting of children aged between 0 and 3 years, and the pre- and school-age subgroup with children aged between 3 and 12 years. During the literature review, we faced more than 340 semiological event types, and based on the Luders classifications, we subdivided our main 28 semiological events groups, which can be seen enlisted. During our analysis, we worked with 21 articles containing data about nearly 1,000 children having paroxysmal episodes with epileptic origin, and 19 articles with nearly 1,900 patients described with paroxysmal event having a non-epileptic origin. And we further conducted the authors in order to get more data about the reported and unreported events. And altogether, we ended up with 87 forest plots. All our articles were retrospective cohort studies, and we worked with pooled proportion of children experiencing specific event types. And let me present our main findings. So the first semiology is arrest, which is a sudden stopping movement of the children. which can be seen in case of the 3-month-old infant. And based on our analysis in the infant subgroup, this semiology occurred twice more frequently among children having epilepsy, and this change was also statistically significant. The next semiology is the hypermotor event, which is a really vigorous hyperkinetic event lasting for several seconds or even 2 minutes. We could see, based on our results, that this semiology occurred 5 times more frequently in case of school-aged children, and this change was also statistically significant. Our third semiology is the tonic event, which is a sudden stiffness in the musculature of the children lasting for several seconds, as you can see in case of the 10-year-old female patient. And this event was appeared in higher frequency in every age group in case of epileptic children, and the change was also statistically significant. And our last semiology is the spasm, which is a sudden muscle contracture, most predominantly affecting the axial musculature, and it can last for several seconds. And sadly, we didn't have enough data to compare our main 2 subgroups in case of the subgroup analysis. But based on our findings, these semiology occurred 9 times more frequently in case of children with epilepsy, and this change was also statistically significant. Our results are unique, as this is the first comparative study in pediatric neurology dealing with high amount of patient data. We use a robust and comprehensive methodology, and we have age-specific characterization too. But we have to deal with relative small amount of articles, different semiology reporting methodologies, and limited statistical analysis. But based on our results, arrest, tonic, hypermotor, and spasm events are statistically significant indicators of childhood epilepsy. Therefore, children experiencing these events need a prompt evaluation by a pediatric neurologist, ideally accompanied by Video-EEG monitoring, an appropriate treatment, and follow-up care too. And for a better management, we need further semiology characterization with sensitivity, specificity, positive and negative value, predictive value studies, which can offer uniform semiology reporting system and differential diagnostic protocol too. Here you can see the stage of our manuscript. And being further interested in the management and differentiation of paroxysmal events, we are conducting a registry analysis using our Video-EEG registry. So the Bethesda Children's Hospital Video-EEG registry was established in 2001. And in the last years, there were more than 1,500 recordings with the aim of diagnosis, differential diagnosis, and pre-surgical assessment. And our aim is to further characterize these episodes and differentiate for a better differential diagnosis and patient management. We included patients into our registry who experienced at least one paroxysmal event, and we are not dealing with patients who didn't experience any event or who had concomitant epileptic and non-epileptic episodes too. And during the last years, we could record more than 36,000 epileptic events and nearly 8,500 non-epileptic paroxysmal events too. And now we are dealing with the analysis of tonic semiology, and we are characterizing aspects like frequency, duration of the events. We included 350 children, and we are at the data extraction phase of the study. In conclusion, we are conducting these 2 studies for a better management of paroxysmal events in childhood. Thank you for your attention, and let me finish my presentation with the words of Rumi. Every child is a different kind of flower, and all together make this world a beautiful garden.
Thank you for this nice presentation. As a pediatrician, I think that it's a very important study because we always struggling as young pediatricians, shall we send the patient to a neurologist or not? Okay, so any questions from the audience? Yes, Siba?
Thanks for your excellent presentation, especially the videos to distinguish, as I'm not a specialist. But I would like to ask about the prevalence or maybe the frequency of such arrest, spasm, different symbologies in children. So how frequent are they?
Okay, thank you. Thank you for your questions. And indeed, the videos can help us to differentiate this episode. So our main findings are that spasm, arrest, hypermotor, and tonic events are specific to epilepsy, and their frequency differ. Tonic events are quite frequent in the pediatric population, but for example, hypermotor events are really rare. Spasm appears more frequently in the infantile age group, therefore has its name like infantile spasm, which is very specific to West syndrome, and arrest is more prevalent in the school age children, but it's not frequent semiology, I would say.
Okay, any other questions? Okay, then I have one which is partially related to the topic. Seeing so many videos, it's really a big database. Do you see any role of the artificial intelligence in the future in the analysis? Because you have a large database, so maybe some...
Yes, it's a great question, and the artificial intelligence role is emerging in the medical field. As far as I know, there are approaches to use artificial intelligence for the EEG analysis with high amount of success, but I don't have data on video analysis too in case of epilepsy, but as far as I know, there are really great results on in analysis of the machine learning based on a good teaching model. So we have data for that. So it can be another study.